Various celebrities have recently made their struggles with either polycystic ovary syndrome or endometriosis public. Star Wars: The Force Awakens star Daisy Ridley wrote on Instagram that she'd tried everything: products, antibiotics, more antibiotics to treat her acne before realizing the culprit was Pcos, a hormonal condition that can cause cysts to grow on the ovaries. Other public figures like Leena Dunham, Padma Lakshmi, and Tihomori Hardrict have all spoken about how endometriosis, which occurs when endometrial tissue, aka natural uterine lining, grows outside of the uterus, has affected their health. And while it seems like bad enough luck to get one of the conditions, some women are unfortunate enough to get both. Though most of the symptoms are different, and they affect different parts of the reproductive system, both mess with your period, both can make you feel like utter hell, and both can cause fertility issues. Although having both is not particularly common, when it happens, it's a double whammy against getting pregnant. While there's not much research looking at how many women end up in the middle of this gynecological Venn diagram, a small 2014 study in Journal of Endometriosis and Pelvic Pain Disorders found that women with fertility and pain issues from Pcos were significantly more likely than women without the condition to also have endometriosis. And a Google search reveals a number of women seeking help after being diagnosed with the two disorders at once. As though all this didn't suck enough, it just so happens that the two conditions are notoriously difficult to get a diagnosis for, and many women go years without knowing what's really wrong. If you're experiencing unexplained symptoms or are having trouble conceiving, here is a guide to help you determine whether you might have Pcos, endometriosis, or both. Polycystic ovary syndrome. Definition: Pcos occurs because of a hormonal imbalance. Sherry Ross, MD, an OB/GYN and women's health expert at Providence St. John's Health Center in Santa Monica, California, tells Self. Specifically, it happens when a woman's ovaries or adrenal glands produce more male hormones than normal, says the Centers for Disease Control and Prevention. According to the Pcos Foundation, 5–10% of women of childbearing age have the condition, but only half of them have been diagnosed. Main symptoms: you have irregular periods. That can mean a period every 2 to 3 months or even a period once or twice a year, says Ross. The length between periods might vary, but when your period does come, it can be pretty heavy. You experience unexplained weight gain. Hormonal issues can cause added pounds, so women with Pcos are more likely to be overweight or obese, says Ross. You grow hair in unexpected places. This is called hirsutism, Ross explains, basically male pattern hair growth on places like your chin, the sides of your face, and your abdomen. On the flip side, you might also experience male pattern baldness. Idris Abdurrahman, MD, a board-certified OB/GYN, tells Self. Your skin erupts with acne. Hormonal shifts can lead to oily skin and pimples, says Ross. You have trouble getting pregnant. Since you don't ovulate on a regular basis when you have Pcos, it can be harder to conceive, says Abdurrahman. Endometriosis. Definition: experts aren't sure what causes the uncontrolled, abnormal growth of endometrial lining that leads to this condition, which affects around 10% of women. Unlike Pcos, endometriosis hallmark symptoms revolve around pain, which is often so severe it's debilitating. Main symptoms: you have intensely painful periods. Endometriosis causes very severe, painful cramps that can be disruptive to your normal daily routine, says Ross. You experience pain during sex or while using the bathroom. The pains often crop up during these activities, says Abdurrahman, although generalized pelvic pain when you're not doing any of the above is another tip-off, according to Ross. You have trouble getting pregnant. Just like with Pcos, having endometriosis doesn't always mean it'll be impossible to conceive, but it can definitely make it tougher, the experts explain. If you happen to have both, there are many mix and match possibilities. You might rarely get your period, but when you do it's horribly painful, explains Abdurrahman. Or maybe you have consistent pelvic pain, and hair is growing in strange places on your body. But since infertility occurs with both, Ross posits that's likely to be the main overlap between the two. Here's what you can do. Hormonal birth control is usually the first line of treatment for both Pcos and endometriosis because it can help regulate periods and make them less painful, says Abdurrahman. Beyond that, the treatments diverge. Doctors can try to surgically remove excess endometrial lining or perform a surgical removal of the uterus and ovaries as a last resort. Those treatments are more targeted at symptoms, so a doctor may prescribe medications to get a handle on hair growth, acne, and potential health issues that can stem from weight gain. And since fertility issues can be the most worrisome symptom for some women dealing with Pcos, endometriosis, or both, IVF may be an option, as can various medications designed to boost fertility.